Hi, my name is Christy Ballard, and today I'm going to be talking to y'all about acute prostatitis, also known as acute bacterial prostatitis. Acute prostatitis is an acute inflammatory condition of the prostate gland that is typically associated with an abrupt onset of fever, dysuria, abdominal, perineal, or ejaculatory pain. In acute prostatitis, the infection is present for less than 3 months. The National Institute of Health classifies acute bacterial prostatitis as a Class 1 prostatitis. The cause of acute prostatitis is the translocation of bacteria up the urethra or the reflux of infected urine into the prostatic parenchyma. Common organisms seen in acute prostatitis include E. coli, Enterococci, Pseudomonas, Klebsiella, Chlamydia, Trichomonas, and gonorrhea. Acute prostatitis is the most common urological disorder in men less than 50 years of age and the third most common urological disorder in men greater than 50 years of age. Incident peaks at age 20 to 40 and then again in men over the age of 70. Risk factors for acute prostatitis include sexual activity, sexual abstinence, multiple sexual partners, unprotected sexual intercourse, urinary tract infections, history of STIs, immunocompromised disease states, BPH, anatomical anomalies such as ureteral strictures, and also a history of prostate trauma or manipulation as seen in catheterization, cystoscopies, and prostate biopsies. 3 questions that are essential to ask a patient in the workup of acute prostatitis are: do you have a fever? Are you experiencing a decreased urine flow, urgency, or frequency? And are you experiencing perineal pain or pain with ejaculation? The first question, do you have a fever, is important to ask because a fever is the body's way of fighting off infection. In acute prostatitis, a bacterial infection is always present. This question will also help the provider distinguish between acute prostatitis and BPH. The second question, have you experienced a decreased flow in urine, urinary urgency, or frequency, is essential to ask the patient because acute prostatitis typically presents with symptoms of urinary tract infections. The third question, are you experiencing perineal pain or pain with ejaculation, is important to ask because with acute prostatitis, the inflammation of the prostate gland can cause pain in this area. This pain can also make it difficult for the patient to sit down. Physical examination for acute prostatitis includes obtaining vital signs, performing a digital rectal exam, as well as an abdominal exam. Vital signs should be obtained to assess for a fever, tachycardia, or hypotension, which can be indicative of sepsis. This would warrant immediate inpatient treatment. Performing a digital rectal exam should be done to assess for any irregularities or inflammation of the prostate. In acute prostatitis, the prostate would be tender, warm, inflamed, firm, or boggy. It's important not to perform vigorous prostate massages if you suspect acute prostatitis because this could spread the infection. An abdominal examination should be performed to assess for bladder distension as well as CVA tenderness. A urine analysis as well as urine culture should be obtained. One common treatment for acute prostatitis is antibiotic treatment for 4 to 6 weeks using the culture and sensitivity in the selection of your antibiotic. Bactrim DS could be used, but fluoroquinolones are the first line of treatment for acute prostatitis. This would include Cipro as well as Levaquin. NSAIDs can be used for an analgesic effect as well as antipyretics for a fever. Stool softeners may also be used to help decrease straining when going to the bathroom. Non-pharmacological management for acute prostatitis includes refraining from intercourse or using a condom until the treatment is completed. You can also tell the patient that they can do a SIDS bath as well as staying hydrated to help prevent more infections or progression of the infection. Fever and dysuria typically resolves within 2 to 6 days, and the infection usually improves in 3 to 4 weeks with treatment. Prognosis for acute prostatitis is good with a 55 to 97% cure rate. Education for the patient should include safe sex practices as well as how to empty the bladder. It also should be told to the patient that they should avoid vigorous prostate massage so as to not trigger another infection or to prevent the spread of an infection. I hope you learned something and have a great day.